to the hospital, police followed them into the emergency room. A nurse felt Jessica's stomach and immediately knew the truth.
You're having a baby, and you're very close to having a baby. And I went, no, I have the flu.
Jessica had gained no weight, had had no symptoms or any prenatal care for 9 months. But now the baby was coming.
Honey, you didn't know, and I was like, no. So then the nurse's face, you could tell that she was scared also, not knowing how far along I was. Was it going to be a full-term baby? Was it a premature baby? They really had no clue.
15 minutes after arriving in the ER, little Alexis Barber was born. 2 weeks later, Ben and Jessica got married as planned, but with one more guest at the wedding.
I think that by Alexis coming into our lives, it was that ray of sunshine that we all needed.
Thankfully, the babies are so healthy. And joining us now to talk more about this issue is Dr. Kristin Bendikson from USC Fertility. She's an assistant professor of OB/GYN. Doctor, this is stunning a lot of folks. And
yes.
How do you not know you're pregnant? How do you not know?
Yeah, well, actually, it's very rare for someone to not realize that she's pregnant at some point along in the pregnancy. Most commonly, this happens in situations where a woman is not having cycles regularly. For example, you can have a young woman that has a condition called polycystic ovarian syndrome, or an older woman who is going through her perimenopausal transition. In both of these situations, a woman may not have cycles frequently, and therefore she's not going to notice if she misses a period, and which is typically the hallmark and first sign of a pregnancy.
But
you know, another. Oh, sorry. Go ahead.
I'm sorry. No, continue. I'm sorry.
Oh, no, I was just going to say another important contributing factor is the weight of a woman. If a woman is overweight, she may not notice a subtle increase in size or weight that she's gaining because of the pregnancy. And in fact, some women that are overweight don't experience a change in their midsection due to the pregnancy.
But the mothers that are here in the studio, and the number one question they said, please ask her, doctor, can't they feel the movement? Can't you feel the baby moving?
Well, if you don't think that you're pregnant and you don't think it's a possibility, these women may have attributed the symptoms and signs of pregnancy to other things, like, for example, stomach issues. How much you feel the baby move, whether it's a lot or a little, is quite variable in pregnancy. The position of the baby, where the baby is kicking, all contributes to how much you feel the baby move. For example, if the baby is in what we call a breech position, which the baby's head is up near the woman's stomach, the baby may be kicking near the bladder. And if that's the case, then the woman may not feel necessarily baby moving, but instead she actually just experiences an increase in the need to go to the bathroom.
I imagine the size of the baby too as a factor. But finally, people want to know, boy, it's stunning and amazing and all that. And thankfully, these babies were born healthy. But to think about no prenatal care for 9 months, that's scary, doctor.
Yes, I mean, obviously there's a lot of dangers to both the mother and to the baby if someone doesn't know she's pregnant. For the mother, you're going to miss out on screening of medical conditions such as diabetes of pregnancy, blood pressure. For the baby, the mother could be taking medications, have medical problems that could impact the baby's health during the pregnancy.
Dr. Kristin Bendikson, thank you very much for shedding some light.
Oh, you're so welcome.
Appreciate it.
Thank you for having me.
You got it.
Bye.
I Didn't Know I Was Pregnant airs tonight on Discovery Health. You can check your local listings.